Hello friends, I am Dr. Anirudh and today we will be talking about appendicitis. The appendix is a small finger-shaped organ which is present in the right lower part of the abdominal cavity. It is attached to the caecum, which is the first part of the large intestine. The appendix usually doesn't have any function in human beings, although it is involved in the digestive process in some lower animals. But the appendix can be a source of problems and disease within the human body. Sometimes the mouth of the appendix can become blocked by food or by fecal matter, and this leads to swelling of the appendix, which is known as appendicitis. When a person develops symptoms of appendicitis, he or she usually experiences pain in the central abdomen. This pain starts around the umbilical area and then migrates to the right lower part of the abdominal cavity within a few hours. There may be associated nausea, vomiting, loss of taste sensation and anorexia. This pain of appendicitis is usually different from that of acidity or intestinal infection. It does not subside by taking normal painkillers, and usually it increases in intensity and can be accompanied by fever and signs of systemic infection. In case there is formation of pus in the appendix, or if the appendix has burst, there might be severe generalized pain in the abdomen associated with high fever and chills. The diagnosis of appendicitis is usually made on the basis of clinical examination. There is tenderness present in the right lower part of the abdominal cavity, and if a blood test is done, it usually shows a raised white cell count with an increased number of polymorph cells. The diagnosis is confirmed by performing an ultrasound scan of the abdomen, which shows a swelling in the appendix. The ultrasound scan usually has a sensitivity of around 50 to 60% in the diagnosis of appendicitis. In case there is a diagnostic doubt, we can go for a CT scan of the abdomen, which increases the sensitivity by almost 80 to 90%. If a diagnosis of acute appendicitis is made and the patient is having all the symptoms, the treatment is by emergency surgery. There is no role for medical management in a case of proven appendicitis, because although antibiotics can help to subside the infection in some cases, there is always a risk that the infection can progress and the appendix can rupture. In such a case, the pus can spread throughout the abdominal cavity and there can be a life risk to the patient. The surgery for appendicitis is usually by removal of the appendix by open or laparoscopic method. Open surgery used to be done in earlier times, but nowadays most of these surgeries can be done by laparoscopic route. The laparoscopic surgery has the advantage of less post-operative pain, less chances of infection, less blood loss and faster recovery for the patient. In cases of laparoscopy, it is possible to inspect the entire abdominal cavity and to rule out other pathology, especially in females. Sometimes while there may be appendicitis, there may be also associated infection of the uterus, fallopian tubes or other pelvic pathology. These can be treated simultaneously at the time of the operation for appendectomy. Once the operation for appendectomy is concluded, the patient is allowed to take oral fluids after a period of 4 to 6 hours. The patient makes an uncomplicated recovery and can be discharged the next day, and they can resume to normal activity within a week or so.